awesome presentations this morning. I'm Rajiv. I'm currently a motor learning PhD student, and Dr. Wolf's lab down at UNLV, and we study primarily external focus of attention, intrinsic motivation, specifically semantic relationships, adjectives, adverbs, action verbs, and all that, and how that affects motor behavior. We talk about return to play protocols, and this is like an open sort of question to everyone. Typically, the motor relearning paradigm is the cognitive, associative, and automatic sort of progression to return to play. I'm wondering if we can kind of change that into, or take that framework and put it into a linguistic framework, so that, you know, we're kind of in the early rehab portions, we're kind of using like a blocked language perspective, where we're repeating sort of like the similar words and stuff like that, and see how that progresses to more changing up what we say every time we give instructions and feedback. I'm just wondering if there's, you know, I mean, there's been research in terms of, you know, finger tasks and stuff like that, but like just from your experiences, you know, early in rehab, using sort of like the same words or repeating the same things versus later on in rehab, sort of making that more complex, just like we would do as a progression for like return to play in terms of motor performance. But this is just an idea. It's an open question to anyone if you have any thoughts.
Dustin?
What was the question?
Primarily, you know, have you had experience with seeing this change in motor behavior in terms of what you're saying to these patients in the beginning of rehab, using sort of, you know, hey, I want you to, you know, push off the floor for a bilateral squat, versus going, you know, later on in rehab, and the first statement you say is push off the floor, but the second statement is explode to the sky or something like that. You know, just kind of change up what you're saying every time. And if that, have you seen any sort of effect like that?
Okay, thank you. I know Ali, you're probably familiar with Ali Gokler's work.
Yeah.
He's in Germany now. He's done a lot of this sort of differential learning and how to change your feedback up. I'd say it's pretty early. I haven't seen any applied to ACL yet. Maybe your work might be pretty foundational for that. There is some interesting data in other pathologies that you can adapt the neural response. So there's an issue where you give a lot of blocked practice. So for instance, if you do like 3 sets of 10 squat units all together, eventually by rep like 4 or 5 or a little later, you'll get much less neural activity to the same movement, because you just start sending just the M1 impulses. And there's some interesting data that looks like if you vary your feedback, so you don't get the same thing all the time, you could force increased sensory integration activities. They sort of have to like reprogram how they're contextualizing movement. So I think it could have some interesting capacities. And I know I talked before about like how you say and your affect and things can have big implications. So I haven't seen a specific like study yet that would tell you what is best, but my advice would be to push that earlier, to vary your feedback as soon as you can, because they'll have to respond to a very contextually varied world with varied input. So maybe sticking with like your same thing all the time. I know it's not exactly getting to your question, but I think that's a pretty early area for our rehab setting. If you have other thoughts, I'd be interested in taking them.
Yeah, to add, I think there might be implications too. I mean, this hasn't really been well studied, but I think how we give feedback and how we communicate with our patients may have a big impact on these psychological factors. Dusty touched on this briefly, and we'll talk more about it this afternoon, but I think there's a lot of room to better understand not only the specific interventions that we provide for our patients, but how the context of how those are done and the impact that that has on outcomes. I think there's a lot of room to learn in that area, not just related to movement too.
Yeah, and I think if you were to use any of Gabby's review papers on what types of feedback, what types of instructions, what type of practice, anything from this motor control and skill enhancement body of literature, I think there's a lot of very consistent things that could be applied with very little cost to whether our patients might get worse. I think that applying all that without having the, sort of the neurophysiologic background or the randomized control trial, is something that I think is pretty easy to say, yeah, I think understanding those pieces and